It is used to replace fluids and minerals lost due to diarrhea and vomiting. It helps prevent or treat dehydration. Having the right amount of fluids and minerals is important for the normal functioning of the body. It is important to take it as directed by your doctor. The dosage and timing may vary depending on the individual's condition. Always consult with a healthcare professional for the best time to take it and the appropriate dosage for your specific needs. When taking it, it's important to follow your doctor's instructions or the directions on the product package. If you have any questions, ask your doctor or pharmacist. If you're using the liquid form, some brands need to be mixed before using, while others do not. Make sure to ask your doctor or pharmacist if you're unsure about your specific brand. If the liquid form is a suspension, be sure to shake the bottle well before each dose. For the powdered form, mix the contents of the packet in water as directed on the product package. Stir until completely dissolved. It's important not to heat this product unless the product package states that it is okay to do so. The dosage of it is based on your medical condition and how you respond to treatment. While taking this product, it's best to avoid drinking fruit juices or eating foods with added salt unless directed by your doctor. If your condition worsens, lasts for more than 24 hours, or if you experience severe stomach/abdominal pain, blood in the stool/vomit, a fever, or signs of dehydration, such as dizziness, decreased urination, severe thirst, very dry mouth, seizures, be sure to contact your doctor. If you believe you may have a serious medical problem, seek medical help right away. If you experience mild nausea or vomiting, try taking it slowly in small amounts with a spoon to decrease these effects. If they persist or worsen, contact your doctor or pharmacist. Your doctor has determined that the benefits of using it outweigh the risk of side effects. Most people using this medication do not experience serious side effects. Contact your doctor immediately if you experience any serious side effects, such as dizziness, unusual weakness, swelling of ankles/feet, mental/mood changes, or seizures. Although rare, seek medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or difficulty breathing. This is not a complete list of possible side effects. If you notice any other effects not listed, contact your doctor or pharmacist. Always consult your doctor for medical advice about side effects and to report any side effects. Before starting to take it, be sure to inform your doctor or pharmacist if you have any allergies or if you are allergic to any of the ingredients in this medication. It's also important to talk to your pharmacist about any inactive ingredients that may cause allergic reactions or other issues. If you are experiencing severe vomiting, difficulty urinating, or intestinal blockage, it's important to consult your doctor or pharmacist before using it. Additionally, if you are planning to have surgery, be sure to inform your doctor or dentist about all the medications and products you are using. If you are pregnant, it's important to discuss with your doctor before starting it. It is also recommended to consult your doctor before using this medication if you are breastfeeding, as it is unclear whether this product passes into breast milk. When taking it, it's important to be aware of potential drug interactions that could affect how it works or increase the risk of serious side effects. It's crucial to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Never start, stop, or change the dosage of any medicines without your doctor's approval. One specific product that may interact with it is mineral supplements, such as potassium. Be sure to discuss any potential interactions with your healthcare provider. It's important to always follow their guidance when taking it to ensure its effectiveness and safety. And as always, if you have any concerns or questions, don't hesitate to reach out to your healthcare provider for more information. If someone takes too much it and is experiencing severe symptoms like fainting or difficulty breathing, it's important to call for emergency help right away. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. Make sure to attend all your medical appointments and follow up with any recommended lab tests. As you start feeling better, you can slowly introduce soft and bland foods into your diet. This may include foods like rice, bananas, toast, boiled potatoes, or any other foods that your doctor suggests. It's important to follow their recommendations for a smooth recovery. IT is a medication used to treat a variety of medical conditions such as asthma, COPD, and certain types of cancer. It works by relaxing the muscles in the airways, making it easier to breathe. The dosage of IT will vary depending on the specific condition being treated, so it's important to follow your doctor's instructions. It's typically taken once or twice daily, and can be taken with or without food. It's important to take IT at the same time each day to maintain a consistent level in your body. Be sure to talk to your doctor about the best timing for you. Make sure to check the storage information on the package before using IT. If you have any questions about how to store it, you can ask your pharmacist. Remember to keep all medications out of reach of children and pets. Do not flush IT down the toilet or pour it into a drain unless specifically told to do so. When IT expires or is no longer needed, make sure to dispose of it properly. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.